Welcome to the 30/30 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Dr. Ruiz.
Hello, everyone. I hope you had a great Christmas. Today's podcast is another question and answer show with my friend Adam Sadowski. In today's show, we talk about heavy metal toxicity, exercise, and chronic inflammation. I hope you enjoyed the show. Hello, everyone. Super excited to end the year with another Q&A episode. Adam, man, how are you doing?
I'm doing great, Dr. Reese. How are you?
Just having fun, man. I just came home last night from visiting my parents in Brownsville, Texas. I drove 17 hours yesterday. And then,
oh my God.
Yeah. And then today I had a full schedule at work. Super happy to be back. I took my dog with me, and that's why I drove. She was just amazing. She was the MVP of the trip. But as you can imagine, I am exhausted, but I can't leave my listeners behind, and I have to finish the year strong with one last show. And what better way to end it with by answering some questions?
All right.
And how was your Christmas, man?
Oh, dude, my Christmas is amazing. Got to see so much family that I haven't seen all year because of school. Because I'm out there in Portland, Oregon, and home is back in New York. So it was just great to, catch up with everybody and just see the whole family. How about you?
Yeah, same thing, dude. I saw a couple of my cousins that I haven't seen in a while, and there's a new baby in the family, so I'm a new uncle again. Got to hang out with the baby, and I ate a lot of corn, so I'm like super bloated, but totally worth it.
Awesome. Any plans for the New Year's?
Nothing yet. I think I'm just gonna chill around the Phoenix area and maybe just have a little toast. I ended up getting a couple of bottles of bourbon in Brownsville. Bourbon is so cool. It's one of my favorite drinks. It encompasses everything about America. It has corn, which is subsidized. What's more American than that? It's the American spirit, meaning like you have champagne, and that has to be from France. Well, bourbon is a type of whiskey that can only be made in the United States. So I'm a big fan of good bourbon. And as you might know, most of the bourbon comes from this tiny little area in Kentucky. And I've done the bourbon trail in Kentucky and tasted a couple of really good types of bourbon. But it's very regional, and all the hipsters are drinking bourbon, so sometimes it's really hard to get like the special bottles of bourbon, and they don't make it all the way out west. So being over there a little bit closer to Kentucky, I was able to find 3 bottles that are super difficult to find. And so I snagged that, and I drove it all the way to Arizona, so I can't wait to give it a try.
Awesome, man. So let's get started.
Yeah, let's get the show on the roll. Let's get the show on the road.
All right. So question number 1. This is a Facebook question, and this person's asking, what is the best way to test for heavy metals, and how do you go about heavy metal chelation in a safe and effective way?
I get this question a lot because, first of all, let's start with, this is not the first place to start. Whenever you have someone in front of you, I'm not going to automatically 100% jump on heavy metal testing as my first choice of treatment. But when you're dealing with special populations, and when you are dealing with people that have been doing, the ancestral diet, and they have been looking for answers, and they've read all the blogs, and they've done everything, a couple of things are very easy to accomplish on your own. For example, fixing your circadian rhythm. Like if you were to see this podcast recording, Adam is wearing orange glasses because he's trying to block blue light from the computer to preserve his circadian rhythm. So that's easy. Those are things that you can do without the help of a practitioner. changing your diet, protecting your sleep, starting an exercise program. All of those things are easy and accessible for everyone. By the time someone is so frustrated because maybe they got like 20% of the benefits of changing to an ancestral type of diet, and now they're sleeping well, they started their exercise program, and they are still not feeling 100% right, where else do you look? And I run a couple of tests whenever you are looking at whenever you come in as a new patient, and your CBC or your BMP, CRP, which is a marker of inflammation. And a lot of times there's this pattern where they might have low white blood cells, or they might have their GFR, their glomerular filtration rate, is not optimal. They might have some anemia of chronic disease. Their homocysteine is elevated. They have autoimmunity. They come in for infertility. And that pattern right there, that pattern is one of global toxicity. So if they have been eating the right diet, if they have tried, elimination diets, maybe they have been treated in the past with candida, they cannot control their autoimmunity to their thyroid, or maybe vitiligo, or any of this autoimmune type of pictures. The next step I take is testing for toxic metals. And the way you test for toxic metals has to be very specific. There are a lot of tests out there. And one question that keeps being asked over and over is testing your hair or your nails a good way of testing? Well, that's old heavy metal deposits. Think about how long it takes for your hair to grow. And then just figure out that if you're testing that, that's maybe an old exposure, or that is something that is being liberated. Another type of analysis is a red blood cell analysis. And at my office, when I was training with Dr. Christensen a couple of years ago, that's what we would use to test for toxic metals. But we were getting very random results. For example, we would test someone, and and I'm just throwing out a metal, their cadmium levels were a little bit on the elevated side. So then we would start the chelation process using IVs, and then we would retest after the treatment was done, and then their cadmium levels might be even more elevated than before. And the reason this was happening is because when you liberate those metals with an agent, like chelating agent, such as the MSA and EDTA, those metals kind of stick around a little bit on your system, and then when you test, it's not a very accurate representation of what you have chelated. So recently, within the year, we changed to a provocation style of test. And what this is doing, it's actually moving the toxic metals that have been stored in your fat. And when we do this, we do it with two different agents. We don't do just DMSA. We do DMSO and EDTA in the form of an IV. And the reason is because each one of these medicines has an affinity for different metals. So when we're using both of this at the same time, we are attacking the problem from different ways. Recently, there was an article on the lead toxicity that is happening in Flint, Michigan. And as these levels of lead have been increasing in the water supply, the fertility rate in Flint, Michigan has been declining. So if you're someone that has started doing this healthy lifestyle and are trying to conceive, it would be a great idea, if you haven't had success in a period of, like, for example, a year, and you've checked all of the boxes, and you've tried all of it, it would be a great idea to start looking into heavy metal toxicity. Now, again, this is not before checking, the number one cause for infertility is actually low sperm count. So it's kind of like let's go step by step. The first thing we should check is make sure that your hormones are on point, that your partner is producing quality sperm, that you are, have good sleeping habits, that you have a good diet. And then if all of that is in check and you still are having problems, then looking into metal toxicity would be the next step. Just recently, I was running a test, one of these heavy metal tests on someone that had all of a sudden started having rheumatic type of symptoms, joint pain, high CRP, and everything was looking like this in this rheumatic kind of thing, And then this person said, you know what? I live in a really old house. It has a lot of mold. And, we started with diet and good sleep and all of that. But before we moved into a more rheumatic type of picture, and this is a person from the Northeast, we decided to check metals, and their levels of mercury were like, I think first of all, there is no threshold. I don't like anyone to have, if possible, any levels of mercury. But it's less than 2 milligrams per deciliter. This person had like 17 for mercury. For lead, they were in the 400s. The chart goes up to the edge of the paper. I don't know if that bar is beyond the paper, because because that's how high that level was. It was like unrecognizable. So we do this chelation process, and then we start seeing these symptoms regress, because what these heavy metals are doing, they are kind of like, they're a stopgap in the detoxification process, and they can cause the symptoms of like anemia, the symptoms of fatigue, the symptoms of toxicity in general. The way we do the detoxification process is very to the point. We do a series of 6 IVs, and the IVs have a combination of DMPS and EDTA. Again, so we can hit the problem from 2 different angles. And as you're getting the IV, we are also replenishing metals that might be lost through the chelation process. For example, magnesium, potassium. And then we add glutathione and B6, because this chelation process can give you a lot of, can give you nausea, can provoke nausea, and B6 is really good as an antiemetic. Depending on the symptoms of the patient, depending on where they are on their health spectrum, we suggest for them to use charcoal. We suggest for them to do some DIM to make sure their liver is detoxifying at the same time, because what we don't want to happen is for this person to start the liberation of these toxic metals. These metals stick around in your bloodstream for too long, and then you start reabsorbing them.
So for those who don't know, do you want to explain what EDTA is, and explaining kind of what it stands for? I know that they're chelation agents, but for those,
oh man, you're gonna put me on the spot. It's ethylene diamine etatricitic acid, or EDTA, and DMPS is 2,3-dimercapto-1 propanosulfonic acid. And those are chelating agents. Now, DMPS is it's commonly used to treat toxicity of heavy metals or mercury chloride in allopathic medicine. So, for example, if you have mercury toxicity, if you have an acute exposure just in the regular world, where you maybe a kid that bit into one of those old-timey thermometers, they would do a DMPS chelation protocol in the emergency department or in a hospital. EDTA, it's another type of chelating agent. So EDTA is used to chelate lead. So as you can see, we're using 2 different chelating agents. One that has more affinity for mercury, and the other one that has more affinity for lead. Also, EDTA is used in chelation of calcium. So it can be used, like, for example, one of the tests that we do for people that are super worried or have a high history of cardiac disease in their family, we can do a CT scan to see the calcium score on their aorta. And there's a great documentary, I forget the name of it, that talks about the story of how the calcium score is the way to predict heart attacks, not cholesterol. And I'll put a link to the name of that documentary. So we check the calcium score with the CT, and then you can chelate the calcium in your arteries using EDTA IV. I've had a couple of cases where I've had people that have tested, their calcium scores, and they are showing higher in the scale, and I don't remember correctly where the risk was, but we were able to reverse that risk simply by doing this EDTA type of chelation. The other way of chelating that is when they go in and they like scrape the carotids. I don't know if you've seen like people that have huge scars along their neck, and they basically scrape the calcium deposits of the carotids, and we're able to do that in a less invasive way. Additionally, if someone does not have, the means or the time to visit our office in Arizona, and they can't do the treatment of 6 IVs, we can do DMSA chelation. And the DMSA is an oral tablet that you can do chelation with. But the DMSA chelation lasts over 3 months, rather than, we can do the 5 to 6 IVs in the span of about a week. You can do one daily. So it takes a little bit longer because it's just one mechanism of action. And we got to go really slow because we don't want to deplete you from the beneficial metals and minerals in your body. So we kind of go aggressive on this. I'm a big proponent of chelation therapy for people that they're getting to the last straw and they haven't seen the benefits of using this more natural way of eating or living, and they still haven't seen the results that other people have. It's very interesting because, first, not everyone that does the testing, not everyone that does the provocation testing comes back as positive, which is a good thing. Because once you start getting a test, and every time you order this test, everyone has positive for something, it means that there's something wrong with the test, and it's not very reliable. But whenever we get a test back and it's positive for one of the metals, they ask, how did I get X metal into my system? And a common one that you might see is cadmium. And that's an easy one to explain. Like, for example, if you live with someone that smokes, or you were a smoker, or you maybe bought a house where someone smoked, that cadmium can accumulate in your body. Things like lead, depending on how old you are, maybe you attended a school that had lead paint, or lived in a house that had a ton of lead. Same with mercury or other radioactive isotopes. Maybe you live in or near a Superfund site. More than likely lived in a house that has some of these heavy metals. But in reality, we live in a really dirty environment. And the burden that we have in this dirty environment is kind of damaging and bioaccumulates over many, many years. Another question that I get a lot when it comes to heavy metals is, well, what about my amalgams? Should I remove my mercury amalgams? That's a more difficult one to answer, because just like I cannot vouch for every single doctor out there to do a proper chelating protocol. I cannot vouch for any holistic dentist to do this process in the right way. One of my friends, you've met Billy, he started reading on the internet about how bad amalgams are for you and how they're leaching mercury. So he went to his neighborhood dentist, paid $150 to have those amalgams removed, and that doctor just drilled them out. No protection, nothing. He started feeling sick almost immediately after that happened. This is a couple of years ago when you were able to get DMSA on the internet. So he went on eBay and bought some DMSA and started dosing it. And now he has a sulfur allergy where he cannot tolerate sulfur compounds. Because in my only guess is that there is some metal burden where every time he eats something that is high in sulfur, he has a little bit of detoxification in the form of leaching a little bit of this mercury, and he retoxifies himself because the detoxification pathways are not clear yet.
Will most dentists even agree to, if you just walked into your dentist's office, would they even just take out your mercury fillings? Or
if you were to walk in to a dentist and you're like, hey, I'll give you $100 if you take these amalgams out, and that dentist says, okay, I would just turn around and leave. It is a big production. And if you have ever seen pictures of this process on the internet, they wear basically hazmat suits and a vacuum to make sure they're pulling out all the toxic fumes as they are removing these amalgams. And that's why it's such a difficult question to answer, because I've read a couple of articles that state that after about 10 to 15 years, the amount of mercury that is leached has kind of maxed out. So by removing the amalgam and putting composite down, you are going to liberate more than if the amalgam stayed in. So it's a very difficult question, to answer. I know Michelle Norris was having a bunch of problems with some health issues, and she decided to go to Mexico and have her amalgams removed. This person in Mexico was highly recommended by, they have they have a bunch of friends in the health fields, and that person was highly recommended, and a lot of those problems resolved after those amalgams were removed. So even that tiny burden was enough for her to not feel 100%. So it's a serious discussion that you should have with your doctor, whether you should remove those amalgams or whether you should do some chelation, or whether you should, where in the health spectrum are you? I'm not a big fan of treating MTHFR explicitly, because it all boils down to, let's have good folate status, let's have some good B12 status, let's try to eliminate any of the things that might be under or over methylating, and you do all of that. You can do all of that easily with diet. But if you haven't figured out if your homocysteine levels are at a good level, if you haven't figured out if you have some histamine issues or some sulfur issues that might clog up your methionine glutathione cycle, figure those out first before you go out and try to do a massive removal of toxic metals from your body, because you might end up sicker than before. So as a moral to this story, Billy, he got himself into a pretty deep hole. And what he ended up doing was he started researching gentler ways of chelating this toxic burden without having to do chelation, because A, he couldn't afford it, and B, he didn't know how to even approach this. So he started getting really deep into saunas. And sauna is a very safe and very gentle way of, basically scraping the top of the detoxification pathways and getting those pathways to start working, so he can later in life be able to do a true chelation protocol under the supervision of a doctor and be able to finally get rid of these problems that he has with his detoxification pathways. He actually presented at the Ancestral Health Symposium, he presented a poster on the benefits on sauna use for first responders during 9/11 and how they have used this sauna protocols to detoxify and gain better health. And he actually put together an ebook on the proper use of saunas. And I think he's pretty close to publishing that on his website. And as soon as that publishes, I want to have him on the show, talk to him about this, his story, and so you guys can start using sauna as part of your health journey, because it is so important to have as low heavy metal toxicity as possible, just for general life, and just to maximize and make yourself a little bit more robust.
Yeah, I think another cool story was Chris Masterjohn was having some heavy metal issues, and he actually got it from, I believe it was his air conditioning unit was blowing the paint chips in his apartment over by where he was sleeping, and he had just like massive amounts of barium concentrations in his body.
And in that coupled with a fungal infection, that's what happens. The problem with the heavy metals is that it can affect detoxification pathways. And so then your immune system kind of starts to attack, things that it shouldn't. And then, and since, you're destroying things, but your detox pathways are not functional, you're just basically retoxing. And all of the things that should be helpful for your life might have a paradoxical effect. Another thing is that you can go a long time with this burden before it actually becomes symptomatic. And I liken this to, like, for example, type 2 diabetes. So if a person was to tell me, well, how come I didn't have any problem, any of these problems 10 years ago, and all of a sudden now I have this problem? Well, same thing with type 2 diabetes. If a patient said to me, how come 10 years ago I was able to eat cereal for breakfast and sandwich for lunch, but now that spikes my sugar? Well, your body is able to buffer for a very long time. It's like a clogged sink. You might have a clean pipe, but then the buildup starts to build, and then now you have a slow sink, and then when it gets closed, now you have an overflowing sink. So it's going to be insidious, and it's going to be a slow buildup to a point where then it's clogged, and then we have to remove the obstacle to health. Again, this is not a panacea, and this is not a test that I run on every single one of my patients. But lately, it seems that a lot of people have a lot of interest in metal chelation. So I wanted to put it out there, and talk about like the reasoning why we might use this system, or who would benefit from doing chelation. So mainly 3 categories of people. People that have been turning stones for a while and they really can't find like the thing that is making them click. People that are trying to conceive, especially if you have used well water, or if you lived in an old house, or maybe you live close to a Superfund site, or you or no one or someone you knew was a smoker. And then the third category of people is people that have had a pretty shitty diet for a very long time, and they are scared of their of having a heart attack and getting a calcium score. And then if you are at risk, doing some EDTA chelation for your calcium in your arteries, that would be the third subset of people that I would recommend some chelation. Again, under the supervision of a doctor. This is not something to take lightly. There has been cases of people that chelated too fast and chelated potassium or magnesium, and then they went into cardiac arrhythmias. So this needs to be under the supervision of a doctor for a good reason.
Yeah, I would think that you could even add another group is people who are sort of, constantly surrounded in that sort of environment. So think like construction workers, people working in older buildings, people working around heavy machinery, firefighters, like you were saying before.
Yeah, and if you have been in contact with heavy metals, constant exposure to heavy metals for a very long time, it would be a good idea if you have this toxicity symptoms, random rashes. You cannot tolerate things that other people find very helpful and healthy, like kimchi, like your sulfur-containing compounds such as garlic, like high-dose garlic, onions, sulfa drugs, and all of those things that some people find very helpful, and you have an opposite reaction to this compounds. Like I remember a patient that had their sulfur reaction was so large that even sulfated berberines, which sometimes berberines that are used for antibacterials or to reduce cholesterol, sometimes they add like a sulfur group to make them a little bit more water soluble. That person was having reactions to even that. Or if you have ever received a glutathione push or a glutathione shot or a glutathione IV and you felt like crap, or if you've tried IVs in the past and after an IV that should be energizing, you feel like crap, there is something going on with your detoxification pathways, and maybe toxic heavy metals might be the culprit.
So are there any for those who can't get access to IV chelation therapy, are there any sort of, supplemental regimens or anything that they could do for, a quote-unquote gentler detoxification of these metals?
So, again, check with your doctor, number one, and then I would highly recommend against doing things like buying the MSA off the internet. I know there's a couple of products on different websites that you can get that you can buy. It can be really dangerous, but looking into sauna, for a more gentler detoxification pathway. And then I'm pretty sure in the ebook that our friend Billy Mitchell will be releasing soon, I'm sure that he's going to have a couple of recommendations that are scientifically based. And I think one of the recommendations is niacin, and it's like low-level niacin. So before you get into that flush, and what the niacin does, it does a little bit of lipolysis. So it breaks apart some of the fat, and where you store your toxic metals, it's usually in fat. And by breaking down these fat molecules, you release some of these toxic metals, and by sweating. So that's the important part of sauna. It's not, the question is usually, should I do dry infrared sauna? Should I do steam sauna? The important thing is sweating, getting you to sweat. Like in Arizona, you can walk outside and just start sweating, and that right there is going to be helpful in detoxifying, and it's going to be an easy and natural and very gentle detoxification. It's going to take longer than doing an IV, but it's something that if you study this and you learn the mechanisms, and it's a very safe way of doing it. Another way that you can facilitate sweating is by dry brushing. I'm not sure if you're familiar with dry brushing.
Like shaving dead skin.
Yeah. So you stimulate the follicles with the dry brush, and by stimulating the follicles, you can increase the rate of the onset of sweating, and you can start sweating faster. So that's going to help you detoxify. And then making sure that your bowel movements are on point, that you're not constipated, because you don't want to start mobilizing this stuff and not being able to have bowel movements. So it's all about mobilizing this stuff in a very gentle way and then eliminating it. So think about charcoal, think about dry brushing, infrared sauna, just sweating in general.
So from a clinical experience perspective, what have you seen as the main side effects for patients getting IV chelation?
The main side effects that I've seen is like fatigue for around 4 to 5 hours after the IV. Although I have seen patients that have felt better than they've ever felt before after their first chelation. The way the test works is, we do a challenge IV with the DMPS and the EDTA, and the glutathione and all this stuff, and then you collect your urine for 6 hours, and then you send a sample of that urine to a lab, and we use doctors' data, and then they examine this sample, and then they send us a report with the amount of heavy metals, your heavy metal burden, and it's standardized to your creatine ratio. So by looking at this formula, then we can modify the IV and see what you need to do in order to be effective at the chelation process. I recommend that for that first IV, for my patients to do the IV and then urinate and then take around 500 milligrams of activated charcoal, and that's to try to prevent these effects of retoxing. And then once it has been determined that the patient has toxic burden, we have a discussion about being able to sweat, being able to have bowel movements, and make sure that protect the patient from retoxing, and making sure that this patient is detoxing effectively.
Are there any sort of drug interactions that can occur with the chelation therapy, or make sort of side effects even worse?
Well, for example, when you're taking enzymes to break down glycolytic deposits or protein deposits in your body, think about Web enzymes and all of this enzymes that you can take. And we have a question about chronic pain in later on the podcast. But yeah, when you take these enzymes, these proteolytic enzymes, you should not take them with food, because if you take them with food, those
digestive enzyme.
Yeah, those enzymes are just going to digest your food, and you're spending your money, so you take it away from food. Same thing with chelation. I wouldn't. The chelation protocols that we have designed are very gentle, but when someone is getting chelated, we have a person in charge of being in the lab, making sure that that person is not getting any tachycardia, that they're not getting any anaphylactic reaction. We cross-reference their drugs to make sure there's no interaction. I imagine that antihypertensive drugs that waste potassium or waste sodium could have an interaction. So we make sure that none of that is happening. And again, when we chelate someone, we replenish magnesium, we replenish potassium, we replenish calcium to make sure that we are protecting that person from having an arrhythmia.
You were saying that some of the chelating agents can take out calcium. Is there any sort of risk for developing something like osteoporosis or osteopenia? Because I'm assuming that you're going to be able to take out calcium from systemically rather than just where the deposit of the excessive heavy metal is.
Well, these are not long-term chronic treatments. These are very acute treatments for a very specific reason. We are constantly pre-testing and post-testing to make sure that what we're doing is having the desired effect. Interestingly, most of the patients that I have prescribed these cardiochelation treatments are older individuals that you would think are at risk for osteopenia or osteoporosis. But this, and it's going to be a question of like the future. It's looking grim because the older population that I'm seeing having this more aggressive calcium deposits grew up in a different environment where they had way more physical activity and they have a sturdier frame. Now, in the future, I'm not sure if that's going to be if that's going to be the same, and I'm not sure if like our fragile adult population that was averse of physical activity will have this type of frame, and in 10 or 20 years, I wonder if that's going to be a more of a consideration that I'm going to have to start looking into. But again, anytime we do this chelation, by the time you are going to get a chelation, we have already discussed your diet. We have already discussed your supplementation. We have already discussed, we have controlled your triglycerides and your HDL and your LDL. So I think that's why we're not seeing an adverse effect when it comes to creating osteoporosis. But in short, this is only reserved for people that are getting into this type of lifestyle at a later stage in their life and have had a history of cardiac disease, whether in themselves or within their family.
So the second question is from Amy, and she's saying, after many years of toying around with different diets, I finally discovered that eating using an ancestral template works for me. Most of my digestive issues have finally resolved. Thank you for your insight. I feel better than I felt in years. Now I finally have enough energy to start exercising. What is the best exercise regimen for someone that is just getting into this type of lifestyle?
That's another great question, because I like to graduate people. I like when people start getting better. I like to set the next goal. A lot of the male patients that I get come in, and I had this discussion with Mike T. They are working out 6 times a week and not sleeping, and they wonder why they feel like crap. Then the other side of the spectrum is these people that have not worked out for many, many years. And they are eating right and they are feeling better, but they wonder why they haven't lost any weight. So it's like two sides of the same coin. Let's focus on diet, let's focus on sleep, but at some point once the fatigue is resolved, nothing will increase your testosterone levels better than exercise. For females, a good way of building and preventing, we just talked about osteopenia. A good way of helping with osteopenia is to have some weight resistant activity. And that's going to give you more dividends than taking a supplement, and it's going to help you regulate circadian rhythms. It's going to help you with insulin sensitivity. It's going to help you just de-stress. And that's going to be very important in the continuum of health. Now, where do you start? And Rob Wolf says that he doesn't like the term exercise. He likes the term movement. And that should be the basis of everything. Adapting your house for good movement. And if you haven't read Katie Bauman, go follow her on Facebook, go read her blogs, go buy her books, because she talks about nutritious movement, as in being able to walk outside in different terrains, being able to do a full squat, without tipping over, having good foot strength so you don't twist your ankle and then fall and break a hip. Once you've accomplished and you have a good movement practice, another thing, before I forget, having a standing desk, and being able to go from standing to sitting to maybe laying on the floor to be able to get up from the floor without any pain. and reaching above your head to reach for, maybe your water bottle or whatever. Being able to complete those tasks it just predicts longevity. But you also have to have some strength training and be able to train with weight on your back or being able to pull and push. Now, a couple of years ago, CrossFit started, getting very popular, and I am a big fan of the tenets of CrossFit. I agree that you shouldn't you should have a lot of variety. I agree that you should do, you should be able to run a 5K or use your rower or the Airdyne. You should be able to do a squat. You should be able to deadlift. You should be able to do some Olympic weightlifting, because that's going to help you with mobility. It's going to help your joints. It's going to help strengthen you. And it's fun because you can geek out in form, and all of these things amount to a healthy individual. A couple of months ago, one of my friends on Facebook posted an article about how CrossFit hurts people. A lot of CrossFit gyms are not designed to be a safe environment. Overzealous younger people that want to start a new business, and maybe they don't have the training, maybe they don't have the expertise, maybe they are genetic freaks that are able to do all of these movements, and they found a lot of benefit from having this high intensity activity, and they want to help others, but they think that everyone is a genetic freak. And then your grandma shows up to the CrossFit and they want her to do Murphy times 2, and she's going to break. So just like when we're talking about dentists and how I cannot recommend just any dentist, unfortunately, because of the system that CrossFit has created, it is very hard for me to say just go into any CrossFit gym and start training there. Even though I love the idea of CrossFit. If you want to look for a CrossFit gym, just like when I said, you walk into the dentist and you ask, would you remove my amalgams for $100? And if they say yes, you run away. You can walk into a CrossFit gym and ask, do you have an on-ramp training program? Or do you have a beginner's class? And if they do have a beginner's class, do you teach the basic movements, or is the first class, let's try to deadlift 100 times and fuck form, just do it, do the best that you can, and if you can't lift that, just take a couple of plates off. If that's the system, just turn around and walk away. Because you cannot just start deadlifting. You will get injured. You cannot just start squatting. You will get injured. You cannot just, one day you're feeling better because you don't have IBS, put on some minimalistic shoes and go run a 5K. You will destroy your arches. There has to be some training period. So make sure that if you want to have this functional movement, make sure they have an on-ramp program. CrossFit was designed to be the least amount of work for the maximum impact. And that's what Greg Glassman had envisioned when he started CrossFit. So it baffles me the way that we think about exercise. We think about exercise as more is more, and that we should be doing a morning and an afternoon CrossFit exercise, and then on the weekends go hard. Like, what? No. The way it should be is, what is the most efficient exercise that is going to hit as many muscles as possible in the shortest amount of time, and then be able to still get a full workout with the benefits of increasing my heart rate, with the benefits of building muscle, with the benefits of increasing agility and increasing flexibility and teaching you something. And if you think about like a short, well-designed CrossFit workout, it can hit all of those things. You can go into a gym with a person that knows what they're doing. You can do some skill work before your workout. So maybe today we learn how to do a snatch, and you do it with a PVC pipe. You kind of like try it, and just go through the motions. Okay. Next, last week we learned how to deadlift, so we're gonna do some work, some strength training. So you do a couple of reps, up to a max out for your deadlift, and see, just so you can build some muscle, and then you end with a 15-minute high intensity, couple of burpees, a couple of strict push-ups, a couple of strict pull-ups, and that's it. You can be in and out of the gym in 40 minutes and hit all of the things. You hit agility, you hit flexibility, you did some strength, and you did some cardio / muscle building exercises. And if you can do all of that, why wouldn't you choose that over going on a treadmill for 45 minutes while watching a rerun of The Simpsons in a place where, everyone is just flexing to flex? Plus, with this type of exercise, you get community, you get people that are going to be there at the same time as you get to socialize, you get to learn, you make new friends that are health conscious. The stuff that Mike Ritter is doing out in Florida, where, with the Result Cult, where, he started doing potlucks, and it has created a whole system of people helping people get better. That is a positive, that is a good thing, and that is the way I envision CrossFit should have been. So CrossFit, no, it's not a competition. You can make a competition out of it, but that's not the goal of it. CrossFit is not an everyone gets injured exercise program either. A well-designed CrossFit program would be super beneficial for everything. And in my dream world, I would love to be able to have a system where we can identify the good boxes, the good trainers, and the good communities that accept elite people and accept noobs that have just started their health journey, and be able to direct them to this place where they can get healthier in conjunction with good functional medicine, in conjunction with good community, with a CSA and a good, like farmers market. And, that would be amazing, because that's how you build a community of health. Another example that I have of this is like Tabatas. So the Tabata, and I forget what the combination is, like 15, 20. It's a very specific timing. And that's what people don't understand. That in Japan, they wanted to see what the most efficient time splits were to create the best workout in the shortest amount of time. And Dr. Tabata came up with the Tabata protocol. So the Tabata protocol was designed for cyclists before the Olympics, if they weren't able to go and get a workout, to do one Tabata. And that was to take place instead of doing a training session if they didn't have the time. But what do we do over here in the West? We design, let's do burpees Tabata times 3. Well, the maximum return for shortest investment is lost, because now you're doing something that was supposed to be done once, multiple times. So we take these things and we completely destroy them.
You have to understand what is it that you're looking for. So in this particular question, she's asking, what is the best exercise regimen for someone that is just getting into this type of lifestyle? I would say, well, what are your goals? Are you trying to lose weight? Are you trying to gain weight? Do you just want to be stronger? Do you want to be faster? Do you want to be better at endurance? Is there a specific task that you want to be better at? I know that you were saying that your vision of CrossFit was a little bit different than what the stereotypical CrossFit is, but not everybody has to do a CrossFit workout, or not everybody has to be good at agility and strength and speed and power. Some people just want to look, better in the mirror. And for them, that's something completely different than somebody who just wants to be able to complete a half marathon, if that's what their end goal is. So I would say kind of, meet people where they're at, understand where their goals are, and try to figure out a way to achieve that goal in a way that's attainable for them. Whether that's lifting weights 3 times a week with a cardio session on the weekend, or trying to gradually work their way up to a marathon. I think it's highly individualized to that person's goals and their life schedule and what allows it for them to be accomplished.
And something that you touched on is exactly that. I don't want anyone to exercise. I want everyone to train. And it's just like this different usage of words, but without a program, without a goal, then what's the point? And your goal can be anything. Your goal can be, I want to be healthier. And that's a very broad goal, but you can quantify it. So let's say you decided to become healthier and then you don't know where to start. You can go online right now. You can go on your iPhone and download the Couch to 5K app. Okay? And you can go from never running before, and in 30 days, you'll be able to run a 5K nonstop. The only thing you got to do is follow the directions. Every day, you log in, you check how many miles to run that day, and then you do it. So let's say you finish your first 5K, and you are achy, and you maybe the cortisol from waking up early in the morning to put in your miles has given you a little bit of a cortisol gut, so you don't feel healthier. You exercised, but you didn't achieve your goal. Okay, so or the opposite. Maybe the goal is to be healthier, and you decide to do CrossFit, and you just hate it. You just realize that lifting weights is not for you. Well, that's not making you healthier. But you decide that road cycling, you enjoy and is getting you healthier. Well, now you're achieving the goal. And there's many goals that you can have. For example, maybe your goal is never to have osteoporosis. Well, that's your goal. Work towards that goal. Because the worst thing that can happen is that you are just aimlessly trying, different things, and you create your special protocol and you never follow it. And that's the second part of this goal and training, that there are so many ways of working out. Like, for example, just throwing something out, if you've never lifted weights and you want to start doing some compound exercises like the squat, like the deadlift, you can download an app called 5x5. And this 5x5 app will give you step-by-step increments on how to increase your squat, how to increase your deadlift, how to increase your overhead press. So if you follow this program to the T, if you're eating enough protein, if you're eating enough calories, if you are, doing everything like you're supposed to do, you should be able to advance and increase the weight that you can put on your back and squat in a very systematic way. The problem that I see a lot of people do is that they're like, oh, you know what? I wanna squat my body weight, okay? Which is not that much actually. Like squatting your body weight is a good goal, but maybe the goal should be squat twice your body weight. But that's a different conversation. And then you start, okay, so I'm going to squat my body weight, and I'm going to use 5x5 on Mondays, and I'm going to use Wendler 531 on Tuesdays, and then I'm going to do some Tabatas, and then I'm going to log into richrunning.com and see what he's doing on Thursdays, because that's going to be my wild card. Now you're not doing any program. Now you're just like mismatching and putting all these things together that make no sense. So being able to take something for 6 months, take something for 30 days, take something for a definite amount of time, and doing it and being able to stick to the program and see your progress. If you're advancing and you're seeing progress and you're doing it the way it's detailed in the program, you should see benefits, because these are tried and true programs. Wendler, Ripeto's starting strength, 5x5. I know there's an app that was created by some guys on Reddit for body weight fitness, and they progress you through a bunch of different exercise programs. Take one of those and start and do it and stick to it and do it for 3 months. And if it doesn't work, either change or seek advice. If you are a noob and you've never lifted weights and you want to be a badass at lifting weights, the best thing you can do is get yourself a personal trainer. Someone that knows their shit and someone that can correct you when you are lifting your heels, if your knees are not tracking properly. Someone that's going to explain to you the difference between a high bar and a low bar when you're doing your squat. I'm of the school of Ripeto, and I like a low bar. And I know, with Olympic lifting, that's a no, but that's how I started, and it's really hard for me to switch to a high bar. So, if you ever see me squatting, you'll see a more of a Ripeto-like stance. But I couldn't tell you why a high bar or low bar is better for you. Get someone that knows their shit to tell you. And then if you are not seeing benefits after you've given it, if you're not achieving your goal, then change.
I also think that another thing to be conscious of, especially when you're first starting out in any sort of fitness-related goals, is to understand that, the best person to compare yourself to is yourself. So, kind of, you can, whether it's every day you're taking notes, or once a month, or every now and then, keep a record or a log of some sort that you can look back on and see how far you're progressing, and understand that even if it's just weights, a 2.5 pound gain on the bar over a period of a month is still a progression. And don't compare yourself to the person on social media, on Instagram or Snapchat or whatever, who can squat 405 for reps or bench press 335 or whatnot, and you're just having trouble with just 25 pounds. Those people have been training longer. You don't know if they're using any sort of performance enhancers or what it is. They might have been at doing the same thing day in, day out for 20 years straight and know what they're doing, whereas you're just starting out, and you're going to see a lot of bumps and bruises, and there'll be probably days or weeks or even months where you feel like nothing is working, and just keep at it, and eventually you're going to bust through those plateaus.
I call it the Arnold effect. I don't know if you've ever heard me about this, where imagine you show up, you're a little chubby, and you're trying to, you want to look like Arnold. So you walk into Gold's gym, and there he is, Arnold, and he's doing curls. And he's doing curls because he wants symmetry on his biceps. So he is so specialized that doing a set of curls will make or break his figure, And then this little chubby kid walks up to him. He's like, "Hey, Arnold, what are you doing? I want to look like you." And he says, "I'm doing curls." If that chubby kid starts doing curls that day, he'll never look like Arnold. You need to eat like Arnold. You need to put the training and the hours that Arnold has put in. You need to have the genetics that Arnold has, and maybe the testosterone levels, hint, hint. And then eventually, if you advance enough, you might get to a level where curls are going to make a difference. But to start having the knowledge base of how's your squat, how's your overhead press, how's your deadlift, maybe some bench, that's going to give you better returns than doing curls. And nothing against curls, people like to have big arms, I guess. But to think that that just by doing curls, your traps and you're gonna get a six pack, and you're gonna get your hamstrings activated. That's that is just that doesn't make any sense. Same thing, it's like, imagine if you showed up and you wanted to be as smart as Elon Musk, and then he says, what I do? Every day I meditate. Cool. So then you start meditating. Well, no, you got to see his education. You got to see his background in startups, and how he was one of the founders of PayPal. It wasn't just the meditation. It was all of the things that he did before that led him to create the Tesla and to create, SpaceX. And so we got to look at yourself at where you are. Look where you want to be, and there are no shortcuts. You're going to have to put in the work at some point.
Don't get caught up on the tip of the iceberg.
Yeah, exactly that.
I guess we can move on to our third and final question. So our third question comes from Antonio, and he's saying, I have had chronic pain on my right wrist for the past 2 years. I am not sure how to solve it. Are there any natural therapies that you would recommend? I feel like I am too young for surgery.
What do you think, Adam? What do you think about this wrist pain?
Well, first, I would have to know more about this wrist pain before making any sort of, jumping to conclusions. And he's had this pain for the past 2 years. So again, knowing, what does the pain feel like? Is the pain traveling anywhere? Can he move his wrist? Are his hands, are they still functioning? Does he know why this pain is occurring, or what he might think is causing it? And then from a natural therapy, I guess I'm a huge advocate of pain education. So, explaining to patients what we understand so far in regards to the pathophysiology of pain, knowing that just because there's pain, that doesn't necessarily mean that there is, in fact, an injury. Recommending a physical therapist, obviously, scanning the wrist and doing any sort of imaging to make sure there's no sort of structural damage that's present.
Yeah, like when we were discussing before the show, what was your first thought?
It's just such a broad question. I have no idea.
It's you need a doctor, dude.
I guess if this was kind of like a test question, I would do my orthopedic testing on them and see if there's any sort of indications for any imaging or anything of that sort.
Couple of thoughts on that question. It's a super broad question. I have wrist pain. What should I do? Well, let's go from like a fucking macroscopic. Let's not lose the forest for the trees. Inflammation, would be a precipitating factor for any type of chronic pain. And one of the things that I clinically, I haven't read any studies on this or anything, is that if a person presents to me with chronic pain, usually I see low levels of vitamin D. Yeah, and I haven't, dude. It's just something that I've seen, and so making sure your vitamin D levels are on point by getting some sunshine, making sure you're not eating dairy and wheat and sugar and rancid oils every day, like the most inflammatory foods that I can think of, making sure that you have a good anti-inflammatory diet. Because one of the things that happens when you're eating like omega-6 heavy oils is that your levels of omega-3 to omega-6s change. So you have a more inflammatory picture. So having a good ratio of omega-6 to omega-3s in your diet is going to be very important for healing purposes. Also, like you said, physical therapy can be very useful in regaining that movement. And if you notice all of the things that you discussed or I'm discussing, we haven't even talked about pain medications. Because what ends up happening when you give up pain medication is that you're basically covering the insulting factor. Like, for example, imagine if you had a rock on your shoe. I can give you some oxycodone and you'll forget about the rock on your shoe. But if you continue walking on it, you're eventually going to injure your foot even more. So the most important thing is to take off your shoe and take the rock off. That's going to be the curative way, the natural way, however you want to say it. A couple of supplements off the top of my mind that I've used in the past with people that had a very inflammatory picture. Okay, have you ever used BCQ or any BCQ combination?
Boswellia, curcumin, and quercetin.
And quercetin. Yeah, Boswellia, curcumin, and quercetin. And going at it kind of like aggressively. I know there's a product called Caparest. And one of my mentors was the product is by Biotics. One of my mentors was using this product. I think three capsules 3 times a day, and this is like a very potent anti-inflammatory. So the curcumin, the Boswellia, and the quercetin act synergistically to reduce pain. I've seen a couple of really good studies with ankle pain and proteolytic enzymes. We discussed them earlier, things like Wobenzyme, but now Wobenzyme has been bought by Nestle, so I'm not sure if I can recommend them anymore because I don't like Nestle. So what happens is that these glycoproteins get stuck in different places around your body. And the idea is that by taking this high-dose enzyme, they basically just circulate around your body, and then they find these glycoproteins and they break them apart. And I've personally never used them consistently enough, or I've never recommended because it can be kind of pricey, and I don't see a lot of chronic pain anymore. When I was at school, I had a bunch of shifts where I was treating chronic pain, but I never used them consistently enough because they are kind of pricey, and you have to heavy dose them. But that's another way of doing it, and then. Couple of things that you mentioned, is the patient able to move their hand? Is this a type of more like neuropathic pain? Is it an old injury? Is it an injury of overuse? So those are things that you have to tease out. So let's start with neuropathic pain. If you have a neuropathy then caused by something like diabetes, where the diabetes has deteriorated arterioles and you are not getting nutrition to those nerves and to that area, and then you start having you're having deterioration. First of all, stop eating shit and start getting a good diet to reverse the diabetes, because you can throw thousands and thousands of dollars by eating all these different supplements and taking all this crap to reverse the diabetes, but unless you change your diet, that's not going anywhere. So that would be the number one. And then once you fix your diet, and now once you have good glycemic control, and once you're you're not spiking in your insulin, a good supplement, there's really good research with alpha lipoic acid. So not the dextro form, the right-sided form of alpha lipoic acid, not the left-hand sided form. 300 milligrams. I think it's 3 times a day or 2 times a day. I'm not don't remember off the top of my head, but it's like one of the few supplements that I've seen good studies for regrowing those neural pathways. But again, if you don't have good glycemic control, then doing the alpha lipoic acid is not going to do anything for you. If you have an injury of overuse, like for example, let's say this is like more of a carpal tunnel type of pain, a PT to strengthen the muscles that are injured would be very important. An OT, an occupational therapist, that can come in and examine your environment and actually, diagnose what the actual problem is, would be super useful. And maybe the ergonomics are not correct. Maybe you can find ways to adapt to that environment and prevent this from happening again. And then I'm going to talk about surgery. I see this a lot with like tears or like a meniscus or like an ACL tear. If you have a tear, no amount of supplementation, no amount of PT, no amount of regenerative injection is going to regrow that cartilage. It's not going to regrow that ligament. So sometimes the best alternative is going to be surgery. It's what happens before and after surgery that is super important. For example, if you have surgery and you don't follow up by correcting your posture, by correcting the muscular imbalances, by maybe you got injured by taking a helmet to the side of your knee. If you don't correct that and you get hit again on the side of the knee by a helmet, chances are you're going to regress and you're going to have that problem again. If your injury is a carpal tunnel type of injury from overuse, from using, a mouse in an incorrect way, and you don't correct that, you're going to end up in the same place, and then the surgery is not going to work. There are complications with surgery, of course, just like with anything, but you can do things in order to make it more successful. Having good nutritional status, eating enough protein, eating collagen, eating, having a good source of vitamin C because of the conversion of collagen conversion, eating a less inflammatory diet. All of these things will set you up for a faster recovery. And if you remove the actual obstacle to health that was hurting your wrist in the first place, you are going to be part of the story that got surgery and was actually successful. Now, I do want to talk about prolotherapy and PRP and stem cells and those types of injuries. So with prolotherapy, if you are not familiar, let's say you have a chronic injury that your body, it's old and your body cannot recognize exactly where the injury is. So just imagine, your whole wrist hurts and your body doesn't know exactly what to fix. It's just sounding the alarm that there's a problem with your wrist. If you inject a solution of procaine, dextrose, and vitamin B12 into the appropriate spaces where that injury might be, you create micro damage, and now your body can localize exactly where to send the cytokine response. That is a paradoxically or a completely different approach than injecting a steroid. Now, if you think about it, what the steroid is doing is reducing inflammation. So by reducing inflammation, sure, it doesn't hurt anymore, but now you have confused the body, and now it doesn't know exactly where the problem is. So you don't get a complete resolution of the injury, and now you have global damage that is not being localized by your body. So by doing a prolotherapy injection, you're giving your body a second chance to heal. So that's basically what prolotherapy is. It's a solution of, and different practitioners, different doctors are going to have different combinations. Some people use lidocaine, some people use saline. My usual formulation for prolo is a combination of procaine, dextrose, and B12. Then people ask, well, what about PRP? So PRP, you get 12 to 18 mLs of blood, you spin it down, you concentrate the platelet-rich plasma, and then you inject that. And what you're injecting now, is growth factors, cytokines, and it's a little bit more. It has more inflammation potential than just injecting the procaine and the B12. And the idea is that now you're giving nutrition, you're giving the cytokines, and you're sending the inflammatory response directly into the injured site. It can be painful, but I've seen amazing results with PRP. And then you can have also stem cells. And with stem cells, that's when you actually go into the iliac crest, or you do some lipo, and then you concentrate the fat cells, you spin them down, you concentrate, and it's very little that you can concentrate, about 1 or 2 mils of actual stem cells, and you inject them into the injured joint, and that will, technically, you're injecting stem cells, so now you're trying to rebuild some of the damaged tissue. Problem with joints is that joints are not very well irrigated by blood and nutrition, so that's why you have so much trouble fixing those joints. And I will post a video to a PRP procedure that is being done at Boston Children's Hospital to regenerate ACLs. Have you seen that?
Mm-mm.
So basically, if you have your knee, if one of those ligaments breaks, they take a little sponge, okay, and they thread a piece of suture to each end of the ligament and through the sponge to create, and what the sponge is doing, it creates a bridge. And then they grab PRP and they flood the area with PRP, and then that creates like a scar, and the sponge creates like some scaffolding, and it regenerates that piece of tissue. It's pretty cool, man. And
that's so interesting.
Yeah, and I'll post a video on that for on the show comments. Now, am I able to reattach muscles or reattach ligaments? No, because I'm not going to go there arthroscopically and put a little sponge and suture and do that. But if there's like a partial tear, there is a very good chance that by sending the inflammation directly to where that point of injury is, you will have a better chance of regenerating that tissue. And if you think about it, that's sort of how like acupuncture works for like muscle pain and muscle, you're creating microfractures with that needle. And even though you don't notice it, when you take the needle out, now you have this cytokine response, and then your body tries to go fix whatever happened, and by proxy, it might fix the injured part. And then people ask me, well, what's the difference between acupuncture, prolo, PRP, and stems? And it's just like the amount of treatments. Like, for example, for acupuncture, you have to be very consistent, and you have to do, like 30, 40 treatments to equal like one prolotherapy treatment. And this is just in my personal experience, I did a lot of work with acupuncture and prolotherapy during school. So this is just like my observations and the observations of the people that have mentored me. So then from prolotherapy to PRP, same thing. You need like 4 or 5 prolo treatments to equal one PRP treatment. And I'm not as well versed on stem cells. I've observed stem cells being delivered, and I've never actually like injected actual stem cells or harvested. But if we could extrapolate, you probably would get the benefit of 3 or 4 PRP treatments in one stem cell treatment.
Hopefully I'll have some more information on that. One of my classmates is actually conducting a systematic review on them. The systematic review is around mesenchymal stem cell therapy in knee osteoarthritis. So with mesenchymal stem cells, they're essentially extractions of newer cells from they can be from different sites of the body. So they use those very early cells that can then be used to be turned into a specific type of cell that you need.
So the pluripotent cells. So before we leave this topic of stem cells, I want to make a very emphatic distinction between stem cells and then umbilical cord cell, or those dehydrated cells. I've seen a lot of people advertise these dehydrated cells as stem cells, and they're not. And I have an interview very early in the podcast with Kristen Comella, and she goes a little bit more in depth into what these dehydrated umbilical cord cells are. And it's basically, women that have donated like either their placenta or their or the baby's umbilical cord for science, and then these companies desiccate the cells and they dehydrate them, and then these cells have a lot of cytokines that are like flags that call in different growth factors and different things, and those have the potential to increase growth in different places, but those are not stem cells. And unfortunately, I've seen some advertisements, of people advertising those as stem cells and charging the amount of money that you could get a true mesenchymal stem cell injection for. And basically what you're getting is just a dehydrated cytokine signaling. So be very wary of, like, if someone if you want to do some stem cell treatments, make sure you do your homework and you make sure you go to someone that is actually harvesting either the fat cells or cells from your bone marrow or your hip, because the worst thing, and it might work and it might be worth it, but I just don't like the idea that they're saying, oh, these are stem cells, and when they're not. Holy shit, man. So it's been an hour and 45 minutes. I think this has been amazing. Any plans for the new year?
So far, none that I know of, and hopefully, as the day gets closer, I know what I'm doing.
But you're in the Northeast until the 5th, huh?
Correct. Yeah.
How's the weather over there?
It's pretty crappy, actually. We had a white Christmas, which was pretty cool, but I could use a little bit less of the cold.
Yeah, dude, I'm dying over here. This morning was 48.
Yeah, I think it's been in the teens this week.
Well, Adam, thank you so much. How's the blog going?
Let's not talk about that.
Yeah, I'm going to keep asking you, dude, until you tell me, yeah, this is the address, and so then we can tell our listeners where they can find you. Okay, dude. Well, thank you so much, and I hope my listeners enjoy the show, and have a happy new year, and I'll see you in 2018.